and I've actually been teaching for over 16 years at the Alberta College of Acupuncture and TCM, where I am co-president. I'm also the director of the Moxicology Institute of North America, which is an establishment between a joint venture between the Ministry of TCM in China, Ministry of Technology in China, Wanfang Data, and ACA TCM. And recently, I've been appointed the Deputy Director of the HSM Hospital North America branch. So in China, in Jiangxi province, there is a few actually, heat sensitive Moxa hospitals. Now we're talking hospitals that are completely dedicated to Moxibustion technology and therapy. And we've recently, just actually before COVID hit here, so this was probably in December, we established our official branch of the hospital in Calgary, Alberta. And so it's quite an honor to be a part of that and working under the founder of the whole system, Dr. Chen Rixin, Dr. Chen, who's also my supervisor as I'm also pursuing my PhD studies. And so it's an honor to be, learning directly from the person who sort of facilitated everything, okay? And so as far as Moxibustion goes, I'm sure, as many of you are practitioners, you know what Moxa is. And it's to no surprise, Moxibustion is Moxibustion. For those of you that don't know, as far as Moxibustion goes, it's an ancient form of healing within the Chinese medicine system. It's been used for over 2,500 years. And so it's not like a new discovery. However, recently in the last 30 to 40 years, it's been revolutionized. It's actually been completely revamped and relooked at following Dr. Chen's system. And so the practice of Moxa is actually very simple. All it is the burning of a herb called mugwort, argyi, aicao in Chinese, on or near the surface of the skin. And so we have this mugwort. I know that sounds like it's something Harry Potter here, mugwort, hogwort, whatnot. And maybe some people look at us like we're coming out of Hogwarts too, right? But anyways, so Artemesia itself, genus Artemesia, there's lots of different species that can be used. Argyi is the one that we use the most. Vulgaris is one that can be used as well. But basically all it is burning this herb once it's dried. And this herb has some very, very interesting therapeutic properties to it, okay? And so often in modern day, when we look at Moxibustion, it's typically thrown under the umbrella of acupuncture. And if you look at textbooks, and even if you look at the concept of acupuncture in Chinese, 针灸 means needle moxa in reality. But most people today, when you hear 针灸, you think of acupuncture, right? But where's the moxa part of all of this? It seems like in modern days, we understand acupuncture pretty well. Acupuncture is a regulated field in Canada, well, most provinces of Canada. And so we understand the needle quite well. However, the moxa, I think, is being a little bit lost throughout time and throughout history, where people aren't using it as much anymore. And even in China, where they do use it more than anyone else, it's still outside of the heat-sensitive Moxa system. It's still kind of fringe, meaning people use it when they feel, oh, maybe I'll burn a little bit of Moxa to help with cold and yang deficiency. How long? Just do it for a little bit. It's very arbitrary. And that's part of the problem with modern day Moxibustion. It is very, very arbitrary, meaning how long do I do it? What is the standard? What is the proven sort of scientific means of how it works? And it's very poorly understood. And if you look at any acupuncture Moxibustion textbook, the books are almost always called Manual of Acupuncture and Moxibustion, Text of Acupuncture and Moxibustion, etc., etc. But where's the Moxibustion? It accounts for maybe less than 5% of any textbook, right? And so it's really kind of a lost art, whereas it shouldn't be, because it's a big, big part of TCM tradition, a very, very large chunk of it. If you're looking at herbology, if you're looking at acupuncture, if you're looking at diet therapy, if you're looking at qigong, tai chi, and stuff like that, Moxa is also one of those big pieces of the puzzle. Okay. And so it's actually something that really needs to be brought to the forefront again because it's such a powerful tool. It's an extremely powerful modality. And we'll discuss a little, we're obviously going to discuss today why. Why so? How is it so different than acupuncture? Is it better? Is it worse? There's no comparison as far as being better or worse. Chinese medicine is a system. And so herbs, acupuncture, moxa, diet, all of those things work together. And I think if you're missing a big part of the pie, then you're actually practicing TCM maybe not in the most complete way. Okay. And so when we're looking at this plant itself, it's pretty. It's a nice little green plant. Yeah. And so why was moxa chosen? Why was Artemesia agri chosen, mugwort chosen to be the plant? Well, there was tons of trial and error if you think back in ancient times. They're looking at the nature of the plant, and it's bitter, it's pungent, and it's warm, right? But when you burn it, it gets hot. Okay. And maybe that sounds obvious, it's not. Because certain other compounds and other plant products, when you burn them, they don't get hotter and they don't emit more energy. They actually combust and they are consumed. Whereas moxa is very different. When the more you burn it, the stronger and more potent it gets. Okay. And so botanically, when we're looking at this plant, it has a lot of unique properties because of that. The fact that when you combust it, it actually becomes more, it starts emitting more and more and more energy. Whereas if you burn a piece of paper, it just basically destroys itself, the whole burning process. Another key aspect to Artemisia itself is it's able to circulate through the 12 channels, which is actually quite amazing. Other herbs do it too, but that's also another big property as far as circulation goes. And so when we're looking at moxa in general, it is used for treatment, but also very important, it is used in preventative medicine. And when we talk about TCM in reality, Chinese medicine is based on prevention. In reality, Chinese medicine is not based on the treatment of disease. It's based on preventing disease. However, treating disease when it occurs. And so if you look back in the classics of the Neijing, numerous talks about stopping pathogens before they penetrate deeper, preventing the body from pathogenic attack, preventing the body from disturbance of Shen, etc., etc. And so basically, if your job actually to do your job properly as a TCM practitioner, usually you keep everybody healthy. And you're going to find, most of you have probably seen this in your own practice. People will come to see you not necessarily when something goes wrong. The key is to educate people on the art of TCM and the fact that you should come see me to maintain your health, right? So that you don't have to come see me when you're in pain. Why wait until you're in pain? Why wait till you've lost bowel function? Why wait till you've lost muscle strength? Right? You come in early, you come in frequently, and then you don't have to come in as much. And so I think that's part of our job as practitioners and also students of the art at the moment is to really, really let the public know that we are here to prevent you from being sick. We're here to strengthen your constitution so that you don't end up with problems down the road. And that's a big part of what Chinese medicine is preaching. And that's how it was designed. And so moxa falls into this category as well. As far as disease prevention goes, it's fabulous. It's actually amazingly well. If you could do moxa on yourself every day, every other day, you would see the difference within a week or two. You'll feel much better. Okay. And so let's look at the general functions of moxa. And the first three I have written in black because I think that's the most common understanding of Moxibustion. Tonify qi and yang. Well, that's easy because you literally combust this material, right? You're lighting it on fire and you're burning it. And so obviously it gives off heat. And then in that aspect, it's going to tonify qi and tonify yang. That's very simple to understand. Eliminating dampness and cold. That's also very easy to understand because dampness and cold obviously are yin pathogens. And moxa itself is very yang in nature. And the yang energy of the moxa can overcome the pathology of yin. All right. So damp, cold. That makes sense. And it goes hand in hand. If you have yang deficiency or qi deficiency, you tend to have damp and you tend to have cold, right? And so in reality, this deficiency of the first bullet results in a relative excess of the second bullet, right? But not all the time. And so you could get invaded by damp cold from the environment, from external pathogenic factors, et cetera, and so you don't necessarily have to be super deficient. Although if you think about it in TCM, the fact that you've been invaded by a pathogenic factor usually means that your qi is already weak, right? If your qi was strong, you typically wouldn't be getting sick, yeah? There are diseases, obviously, like COVID, right? Which can overcome a relatively healthy immune system. There are severe diseases like Ebola that can overcome a healthy immune system, right? However, those are not the most common. And so the majority of times when people get sick, it's actually due to internal deficiency, all right? Internal deficiency. The third bullet here, we have circulate the meridians and collaterals. And so we're talking about overall qi flow through the system, right? And Moxa is one of the best modalities for qi flow. Acupuncture also excels at moving qi, right? However, Moxa and acupuncture do it in slightly different ways, although the end result is probably very, very similar because it's all about circulation, correct? It's all about circulation. And so those are the three most common functions of Moxa that probably the majority of the general public understands, all right? Especially if you're a practitioner, especially if you went to school and you took TCM, et cetera, et cetera. The last two I put in red. And these are two things that you may know or you may not know. And so eliminating heat and toxins. This seems like a contradiction because we are literally adding heat to a system. So how could this eliminate heat and toxins if you're adding heat into a system, right? And, you know, this is the biggest question people ask actually. So if someone has, let's say, excess fire or heat in the system, can I do Moxa? And my answer is, you can do Moxa if you do it right, okay? If you're just doing Moxa sort of loose random parameters as far as I'll just burn some Moxa cones and maybe I'll burn 10 cones on this point and then call it a day. Those aren't parameters, all right? That's just randomly saying, okay, I'll just do that, okay? If you follow the system, the heat sensitive Moxibustion system, you can use it to treat anything. Doesn't matter if it's hot, doesn't matter if it's cold, doesn't matter if it's excess, doesn't matter if it's deficiency. And that's the beauty of the system itself. And I will obviously explain that to you. And so eliminating heat and toxins is big. How can Moxa actually do this? Because Moxa regulates the system, right? And a concept that some of my students may know, in reality, when we say heat, you know, Chinese medicine talks about heat and we're like, what's heat? And you think, oh, well, it's when you have, you know, you could have a higher body temperature, you could have dryness, you could have fluid deficiencies, you could have redness, right? And it's like, okay. And so when people try to explain heat in Western terms, what do they usually say? Well, it could be an infection, it could be inflammation, et cetera, et cetera, et cetera. However, let's take a step back and think about what heat actually means in TCM. And this is a concept I've been sort of formulating for many years. And heat in reality in TCM, internal heat, right? We're not talking about you getting a sunburn or you getting heat stroke from sitting outside in the sun too much, enjoying the beach, et cetera, et cetera. When we talk about internal heat in Chinese medicine, what actually is that, right? And when we treat heat, you know, you do points that clear heat, etc., right? Like an Li11, an Li4, a spring point, a sun point, a river fire on Yang channel, etc., etc. What are we actually doing? Are we puncturing a little hole and then the heat is venting out through your system? Some may think that's the case. I don't think so. And so when we're talking about heat in TCM, heat is basically your qi that is no longer functioning the way it should. All right. And so the term I use when I teach people this, I usually say it's rogue qi. right? So in my mind, heat is rogue qi. All right, so rogue qi. It's qi that no longer is functioning the way it's supposed to. Whether it's not the right amount, it's not flowing in the right direction, it's not nourishing the right structure, and it's just not doing its job. Okay? And so we call that heat, right? Because if you look at the types of heat we have, there's heat, fire, yang, rising, wind. Those are all yang pathogens. In reality, all of those things were your normal qi. However, it's no longer working the way it should. And thus it becomes rogue. It is no longer following the main system. Okay? And so that's why I call it rogue qi. So why would moxibustion be good for treating something like this? Because moxibustion circulates the meridians and regulates the function of qi. And so by regulating the function of qi, right, that heat will clear. How does it clear? Well, you give the heat focus now. It gives the heat a focus, it gives the qi a purpose. And thus qi now will not be rogue anymore and fall back into normal circulation. Okay, fall back into normal circulation. And so when you do a point like Li11 or Li4 and you're saying you're clearing heat, you're not venting it out of the system. There are ways to vent heat out, whether it be, gua sha, cupping, bloodletting, of course, right? And those are letting heat out. But in general, what we do in TCM with acupuncture, when we're trying to clear heat, we're actually taking that abnormal qi, that delinquent qi, and putting it back into normal circulation. And so you take rogue qi and turn it back into physiological qi. All right. And so that's one way to look at it. All right. Maybe agree, disagree, that's fine. But that is definitely one way to look at it. Okay. Another aspect of it is if you believe in the fact that, and one of the elements of heat and toxins is potentially infection, right? How can adding moxa get rid of that? The fact is, microbial microbes themselves in general, when we're talking about bacteria or viruses or fungi, whatnot, every organism, every cell has an optimal temperature which it likes to basically grow and thrive in. Okay, and so when you alter that temperature, right, you can change drastically the whole physiology and morphology of these microbes. And especially if that microbe is in a superficial part of the body, moxa gets very, very hot, right? And so it can be extremely antimicrobial, all right? That's the moxa heat itself. The moxa smoke, which we'll also talk about a little bit later, also has some pretty potent antifungal and bacterial type function to it as well. Okay, and we'll look at that later. And so this last bullet here, tonify yin and blood, that sounds totally contrary again. How can I tonify yin and blood? If I add heat into a system, if people are yin deficient, they're going to have deficiency heat. If people are blood deficient, there's potential they'll have wind, right? And so if we look at these two things, I'm just going to draw it out quickly just in case, So blood deficiency will typically lead to wind, right? And then when we're talking about yin deficiency, this typically leads to deficiency heat, right? That everybody understands, right? Deficiency heat. Now, what's the underlying theme here once again? These two things are yang pathogens, right? They're yang pathogens. And thus they are actually rogue qi, once again. Yeah? They're part of this whole rogue qi type theory. And so when you have these types of things, it's like, well, if I add heat into a system, wouldn't this cause problems? If I add heat into the system, wouldn't I make yin deficiency and blood deficiency worse because you dry up the yin and dry up the blood more? You would, if you don't do moxa right. Okay? If you're just taking moxa and just moxaing some random acupuncture point, hoping it will tonify yin, it probably won't work very well. In general, though, moxibustion is a very tonic type therapy, right? it boosts, and I'll talk about how it's boosting your system. Okay, so it can boost the yin and it can boost the yang, right? It works faster at tonifying qi and yang. However, it can work on yin and blood. It can also help regulate the aftermath, which is wind and deficiency heat that results from yin and blood deficiency. Okay, and so Moxa, if done properly, can address all of these problems. It doesn't have the limitations which is commonly believed that it has. Okay. All right. Oops. There we go. And so some research into moxibustion, actually, there's lots of research out there and there's lots of interesting studies. Obviously, we're not going to talk about everything, but moxa basically, some of the physiology behind moxibustion here. So moxibustion has been shown to trigger the body's heat-sensitive and polymodal neurons, both at the surface of the skin and deeper tissue. So it's actually eliciting a neurological response, right? Because your nervous system obviously is one of the two main control systems in your body, the nervous system, endocrine system, right? They help regulate everything in your body. They also sense your environment. And so when you do moxa, actually, it does trigger these aspects of your nervous system, okay? And we'll talk about a little bit later what that could translate into. And so moxa works on both, a sort of thermal stimulation, but also, this is key here, the emittance of infrared radiation. And actually, that's probably one of the most powerful aspects of why moxibustion is so good. It's the infrared. All right. And so, it's pretty popular these days when we talk about infrared saunas. People go for, infrared light therapy, et cetera, and people always feel better. It's shown to detox, et cetera. Well, here we go, infrared. Why is infrared good? Because what is our source? What is our natural source of infrared? The sun, correct? And so the sun's rays, we're actually absorbing, in TCM theory, we're absorbing yang, right? So in the Neijing, it says, in the summer, you can sleep a little bit later, you wake up a little bit, still wake up early, but you should be outside absorbing all the free energy of the universe. And I totally agree 100%. And you can translate part of that to vitamin D and et cetera, right? The sun is an important source of energy and it's free, right? You're not paying for the sun. You're paying NMAX to heat your house, but you ain't paying for the sun. And so it is a good idea to be out to absorb as much free energy as you can during the warmer months of the year. And we don't get that as much, right? Our summers are relatively short here in Calgary, right? And so it is a very, very important thing. But infrared is huge. We'll touch on that in a sec too. And so direct moxa can reach 130 degrees outside and 56 degrees in the subcutaneous layer. That's really hot. Obviously, we don't let it get to 130 degrees. You're burning people real bad, yeah? Indirect moxa can reach 65 degrees outside and 45 degrees in the subcutaneous tissue. And in reality, when we're doing this heat-sensitive moxa system, we're actually trying to get the skin primed to about 40 degrees, 40 to 42. All right, that's kind of the key. That's when our moxibustion works the best, if you can get the skin to about 40, 42 degrees. All right. And so looking at other physiological effects, moxa has an interesting function of being antipyretic and thermolytic. And so what is antipyretic here? We're talking about, actually they both mean pretty similar things. Pyretic means, some organisms are pyretic. And what that means is they induce fever and high temperatures in the body, right? Via the endotoxins or exotoxins they secrete or the metabolites they secrete into your surrounding tissue and into your blood. So moxa has the ability to be anti-inflammatory in that aspect. Thermolytic means it actually breaks heat, so it's actually anti-fever as well. And so it's anti-inflammatory and anti-fever. And so this is classic. This is classic as far as moxa when we talked about bullet number 4. It clears heat and toxins, right? Okay, and this is something which normally people don't think about moxa for. They think about it when you're really cold and shivering and when you're low energy, not when you're heated, right? Not when you're inflamed. But if you do it right, it's excellent and it works fast. And so vasoconstriction at the burning point, well, vasodilation around the point, which then increases peripheral arterial blood flow and microvascular permeability. Those are two very important things. Obviously, blood flow is always important, right? And that's why we should never really ice things too bad unless you really, really have to. And if you can't turn your neck this way or that way, but you have to get through the workday, you can ice for a bit. But as we know, ice in Chinese medicine, cold is your enemy. You never want to put cold on anything. The reason why is it slows down qi and slows down blood and causes stagnation. All right? Even from a Western perspective, it makes total sense. When you slow down blood flow, I guess for those of you in my biochem class, when you slow down blood flow, what do? You slow down molecular collisions. And by doing that, you slow down enzymatic reactions. Your enzyme cannot meet your substrate. You do not perform cellular function, right? And so in reality, cold itself, the ice pack, it's a Band-Aid effect, and we all know that. Anybody that prescribes it knows it. But sometimes you just need to do it, right? Because you got to function. And so we do it. We don't do it too long, and we do it basically as this sort of get me through the day type thing. The problem with icing reoccurrently or consistently is it obviously slows down wound healing. And so if you have tissue that's damaged, whether it be a strain or a tear or an injury, you're going to slow down the whole overall healing process. It also slows down, because it slows down healing, it's also slowing down your immune system, correct? And so those are two things you don't want to slow down, all right? The third bullet, actually, I found super interesting when I started researching this years ago. Increase in heat shock protein production. And heat shock proteins are fascinating. I remember first hearing about heat shock proteins, I think in university, so it was a while ago. It was like in the 90s. But yeah, heat shock proteins are an interesting phenomenon. And so all cells, bacteria included, not viruses, because viruses are not alive. And so when we're talking about all cells, they always have a response to temperature changes. And when it talks about high temperature, to protect itself, the body starts making heat shock proteins. The cells will start turning on genes that actually produce heat shock proteins. And heat shock proteins have functions of protecting the cell from heat damage, but they also have immune response and immune modulating functionality. And so it triggers the immune system to work, right? And if you think about it, when you talk about different types of heat shock proteins, what is the thermal tolerance of us as a multicellular organism compared to the thermal tolerance of a single bacteria? We probably can handle a lot more, right? For the most part, okay? And it's like, no, people say, no, there's bacteria that live in deep ocean vents and live near volcanoes. Yeah, but those are not infecting you, okay? And so we're talking about the average bacteria that lives in the air or lives on the keyboard that you're using, et cetera, on the door handle. Those guys aren't super resilient to high temperature. And so Moxa there as well can make their life very difficult, so to speak. Okay. And so from a thermal radiation perspective, we're talking about the emittance of infrared, right? Emittance of infrared. And infrared has many interesting functionalities on the human body in general, all right? Infrared can produce heat itself, yes, in the form of electromagnetic waves. And we know that all molecules emit and absorb energy. That's just how the physics of the universe works, right? But when we're talking about infrared, it has been shown to increase blood circulation, cellular metabolism, and enzymatic activity, right? And once again, what were we talking about? Increasing the flow of energy in the system, whether we want to call it qi, that's one thing because we do TCM. But when you increase the flow of energy, you increase function, right? Overall, you increase function. So it is quite profound. And so when people do the infrared saunas, why are they doing it? Because they sweat, number one, they can sweat out toxins like we do in TCM, right? They also increase their circulation. And they're also being hit by infrared rays that penetrates pretty deep through subcutaneous tissue, right? Infrared doesn't just bounce off the top of your skin, it absorbs, all right? And it helps stimulate cellular growth. And so when we're talking about moxa as an overall healing or tonifying technique, it is excellent, mostly in part to its infrared emittance. All right, infrared emittance. Okay. And so I always show this slide because this is taken from a study in 2013. And I love this. I just love this chart. It makes me feel good. And I'm not trying to offend anybody, but yeah. So this table looks at the intensities and peak wavelengths of infrared radiation of traditional moxibustion, and then other forms as well. So when we're talking about a moxa stick, all right, traditional moxa stick, what is that? I think most of you that are practitioners obviously know what a moxa stick is. You may not have seen sort of the sticks that we have, and so we carry a very unique version of the moxa stick. And so this giant cigar looking thing, yeah, guess you could light this up and whew, no, burn your lungs. This is what we use for heat sensitive moxa. This type of moxa stick, it's got no logos on it. This type of moxa stick was designed by Dr. Chen for heat sensitive moxa therapy, right? And it's interesting because you cannot even buy this retail in China anywhere. This is actually specially made for practitioners, okay? And so it's a 2.5 centimeter diameter. It's thicker than most, right? That's my finger. So it's pretty big, yeah? Smells fabulous. Of the highest quality of moxa. And so this is what a traditional moxa stick looks like. And typically what you would do is you would grab a lighter. I'm not going to do it right now. You would basically light the stick, yeah? It'll combust, and it'll start to give off a lot of smoke and a lot of odor, all right? And then you hold that over the areas of the body, right? Probably about 4 centimeters is pretty good, right? 4 or 5 centimeters is pretty good there, okay? And so looking at the traditional moxa stick, this is just an average stick. Ours actually produce probably more than this. The intensity of the radiation in millivolts is 43,000 roughly millivolts of infrared, peaking at 3.5 micrometer wavelength. Okay, that's a lot of infrared. As a reference point, we have a 555 cigarette, which is just a brand in China. All right, doesn't matter. It could be a Marlboro, whatever. It don't matter. And so a cigarette, if you light a cigarette, the amount of infrared it gives off is roughly 37 millivolts. Yeah. Now you compare 43,000 to 37. That's a huge discrepancy, right? But a cigarette also is not designed for therapeutic effects, correct? Well, inhaled, I guess, but not for actual moxibustion. Now, the interesting thing about this is this guy here, because I think a lot of practitioners, especially in North America, use this smokeless moxa stick. I don't have one with me right now. We do carry them at the school. And so what they look like is a cylindrical piece of charcoal. I'm not saying it's a piece of charcoal. It looks like a cylindrical piece of charcoal. It's black, and it's just like, it comes like this, but smaller, and it's just this black, really, really hard piece of modified moxa, right? And how is it modified? Because it's smokeless. So when you light it, number one, it takes forever. But when you finally get it lit, it doesn't produce a lot of smoke. It still does a little bit. So I think the name smokeless moxa is a little bit misleading. It still produces a little bit of smoke, all right? And it still produces some odor, but it's greatly reduced. And it's the most common form of moxibustion used in North America, right? Why is it the most common form? Well, for those reasons I just said, because it doesn't produce very much smoke and it doesn't produce very much odor, okay? However, look at the intensity of the radiation of the infrared coming off. It is a little bit less, but I would say statistically on par with a cigarette, right? And so where is the therapeutic value of it? It's very minimal. So you could just light up a Marlboro and just do Marlboro Moxibustion on somebody, to be honest. Like a Marlboro Red or something, who knows, okay? That is profound data. Like when you look at this, it's just uncomparable, right? Uncomparable. Does that mean the smokeless Moxa sticks don't work? Yeah, of course they work. They still produce infrared. They're still producing heat. They're still moving qi, but how much are they doing, right? How much are they doing? And are you going to be able to use the smokeless Moxa stick to achieve the same therapeutic value as a traditional stick? I'm going to say no. All right. Okay. And the research points to definitely not. Okay. Interestingly enough, when we look at Moxibustion, this is indirect Moxibustion. This is where you take a loose Moxa. This is loose Moxa in a roll. You take it loose in a bag. All right, and then you just make it into a cone and you put it on the body. However, we're using an insulator here. The first one is Fuzi, which is monk's hood, aconite, which is a very, very potent yang tonic and also very poisonous. Aconite is quite deadly, and so obviously we know how to use it properly, right? So Fuzi, ginger, and garlic are the three most common indirect Moxibustion mediums. And you can see their energy levels 680, 520, 595. And as a control, a cucumber and a carrot, these are controls. No, there's no such thing as carrot or cucumber Moxibustion, all right? Those are controls. They're just trying to show you that it doesn't produce as much heat. Although the cucumber is quite interesting because cucumbers are thought to be one of the coldest, cooler foods or plant materials on the planet, but yet it conducts the heat quite well, which is interesting, right? Okay. And so what this chart is trying to tell you is if you're going to do Moxa, you should do it properly, right? Technology, like I've seen stuff where there's spray on Moxa and stuff. I'm like, oh man, please no. Just do it the way it was designed. Like all of this technology making things easier. It's like acupuncture needle inserters, like this little pin, acupuncture pin that shoots needles. Like just use your hands. Like honestly, like why do you need to be that lazy? Just get it done. All right, it's not hard to do. Okay. No offense to anybody that uses that stuff. I just, maybe I'm too traditional. I'm a little bit too old school in my thought, but I feel I respect that the ancient Chinese were able to come up with this amazing system of treatments and healthcare that evolved over thousands of years. I trust that, right? I don't think we can make it better, all right, to be honest. And there are devices out there that claim that they're the same as Moxibustion, like a Moxa pen and stuff for like $2,000. I'm going to tell you this, Dr. Chen's group in China, they've tried to reproduce this stick, burning this stick. They've tried to reproduce using devices the same type of energy. It is not possible yet and may never be. They've tried. And honestly, if we can sort of eliminate one of the main issues with Moxa, which is smoke and odor, then obviously it makes it a lot nicer, right? But it's not possible. The reason why is when you come up with an electrical device that gives off infrared, you kind of have to pick a spectrum, right? A certain intensity. Whereas Moxa is not one. It's many different things. There's lots of oils and compounds within this plant that when you burn, they all burn differently and they all emit different radiation. And so it's impossible for a man-made device to mimic that completely, right? This is a natural combustive phenomenon, which you cannot really reproduce in a machine, okay? But yeah, I love this slide. It's one of my favorite slides, just to show people, right? And no offense if you use the smokeless stick. I understand you're using it because that's all you can use, right? And in some people's clinics, you can't even use those. Even the small amount of odor that gives off in some clinics is too much. And I understand that. All right, I totally understand. But we have a solution.
Hi, Dennis. I'm so sorry. Are we allowed to jump in with some questions while you are giving the presentation?
I think it's okay if yeah, like I can probably answer them pretty quick. We're gonna do Q&A at the end, no, for sure. Yeah.
Thank
So
you.
yeah, maybe just hold the questions for now. Yeah. Remember them though, don't forget. So pharmacological effects of moxa, and so this is where it's super interesting. And so the over 60 different compounds, have been identified within Artemesia agri. And these are volatile oils, ketones, and trace elements, whatnot. But volatile oils, I think, is where a lot of importance is. The reason why is this is what is burning. As you know, oil burns slow. Yeah? And you can't just put it out, right? It's very, very hard to put out. And so it's these different volatile oils within this plant itself that gives it a lot of these interesting properties. All right. I just went off screen there for a sec. So this is a stick that I broke in half to do a demo later on. And so that's kind of what it looks like inside, right? It's a coarse sort of, almost like a wool-like structure. All right, almost like a wool-like structure. Maybe I'll refocus that there. It's focusing on my face too much. Okay, all right. And so identifying those things is very, very interesting. It's showing that, when you burn this plant, all these things, different things burn at different rates and give off different energy to give you this whole that ancient Chinese medicine says this is the effects of moxibustion. All right. So very, very tough to reproduce. Okay. I personally feel don't even bother reproducing it. Just use it the way it's supposed to be used because I feel you'll never be able to make it as good. Okay. And so the Hubei province in China has always produced the best quality of moxa, even since ancient times, right? It's amazing. And so even a pharmaceutical company which has different bases in different provinces in China, moxa from Hubei province is always the one that emits the most joules of energy per gram. So energy of combustion, they're 18,000 joules per gram. It's a lot of heat. A lot of heat. It's not like burning some newspaper, okay? And so upon combustion, it's shown that the moxa can also increase smooth muscle contraction in airways, increase lipid metabolism, free radical eliminating antioxidant function, etc., etc., etc. All right. And as I said before, research has gone into basically showing how when you burn moxa, the more it burns, the more it becomes active. It gets stronger and stronger the more it burns. And so in reality, when you light one of these sticks, it probably takes about 5 minutes, roughly 5 minutes to reach maximum capacity. All right. Whereas if you burn anything else, it could be burned and finished in 5 minutes, right? The other characteristic is it burns well and it burns slow, right? It's a sustained energy. It's a sustained burn, which makes this actually quite phenomenal. Okay. For a treatment, a stick of this size, right? For a typical heat sensitive moxa treatment, I would probably use about a third of this stick, right? And you can buy cheaper moxa, okay? But you will see it will burn faster. It will have lots of impurities in it typically. And so things are more expensive often for a reason. You get much better therapeutic effect. And because we do sell these and people say it's too expensive, it's like $10 a stick. I'm like, yeah. Well, you can go buy the $2 one, right? But you're gonna use but I'm only using a third, right? So it's about $3 per treatment. You can go buy those cheap ones. You're gonna burn through more of them in reality, and you're not gonna get as good of an effect, to be honest. All right, and it's not just us kind of trying to say pushing a product, but the research is being done. All right. And so Moxa Smoke. Moxa Smoke is interesting. And so this research group did some studies and looked at solid phase microextraction gas chromatography. So, big abbreviation there. And isolated 61 different peaks and 23 ingredients in the smoke itself. And actually, what's interesting is because, we're living in COVID times. In China, it's very, very common for them to use Moxa Smoke to purify and clean the air within a room, right? It's super common. The smoke has extremely powerful antimicrobial function to it. Part of it is it burns, because you're burning these oils, a lot of the oil comes off in the smoke. And if you think about it, when oil binds to particles in the air, it will stick to it, right? And those particles, whether it be free-flowing viruses, free-flowing bacteria that are on droplets, they will get stuck to the moxa oil and then they will drop, right? And that sort of thing then, basically it's gluing and sticking to all of the impurities in the air, right? So you can basically light a moxa stick, the room's gonna fill with smoke, right? You give it a couple hours, you open up the windows and vent out. But that room should be clean, all right? It's amazing, okay? You can also use the smoke actually for antiviral, but also antifungal things. So people have skin conditions. If you have a skin lesion, let's say you have ringworm, I don't have ringworm, thank goodness. But let's say you had ringworm, which is fungal, right? And it's here, I can moxa it, but I can also moxa and then let the smoke just seep into the skin. So I would literally hold the area that has the disease and burn the moxa under it and let the smoke fumigate the area. Very powerful, extremely powerful. And, you know, no side effects besides maybe smelling a little bit, okay? You know, antiviral and antifungal drugs are usually quite harmful to the human body. Yeah, they're typically pretty damaging on your liver, and they don't necessarily work that well, anyways. Okay. But yeah, very, very powerful for wound infections, sort of gynecological issues, etc., etc. Right? Smoke fumigation has the benefit of being very, very penetrating. In addition to being able to get into areas where other medication is unable to get to. Okay. Moxa Smoke. So, this isn't a history class, but some things in history cannot be ignored. And so throughout the history of TCM, Moxibustion has been talked about as this last resort, amazing treatment, which basically has been documented throughout various classic Chinese medical texts, all right? And so, for example here, in the Neijing, it talks about, there's a line where it says, when acupuncture can't treat disease, moxibustion should be used. So it's like, I tried my acupuncture, didn't work, well, it's time to use the moxa. Within this famous book as well, Yi Xue Rumen, during the Ming Dynasty, when acupuncture and herbs have no effect, moxibustion should be used. And a famous TCM practitioner, Bian Xue, talking about his personal experiences, he said, to live a long, prosperous life, you want to moxa every day, right? And so, you know, these are just some examples. There's lots more. But why would an ancient book, like, and especially the Neijing, right, say this, right? But in reality, you know, it says this, but nobody really listens. Okay, but I feel that's the thing about the Neijing in general. People think about the Neijing and look at it, yeah. All this stuff isn't necessarily that relevant. All of it is super relevant, right? You just have to see how to apply it. And so when we're talking about these miraculous effects of moxibustion, right? How come everybody's not doing moxa today then? What's the problem? There must be an issue, right? And the issue is we don't know how to do moxa. We're not doing it the way the ancients were talking about it. We're doing it in a way which is not inefficient, but not as efficient as the ancients of Chinese medicine were saying. And so we've lost something along the way. And that something is actually quite significant. All right. There's no reasons I trust that these were written in text for a reason. And the reason was that moxibustion is that magical. However, we've really lost our ability, and we've really lost the true understanding of how to apply it properly. Okay. And so, yeah, the question is, how can moxa be even more effective? And the big question that I've always said is, are we missing something? Are we doing something wrong? And unfortunately, the answer is yes. We are not doing moxa how it was designed, right? We're doing moxa in a way which doesn't achieve superior therapeutic effects consistently. And that's the key word there, consistently. Sure, you can do moxa and get really good results, but do you always get good results in moxa? And do you always use it? Because if it were always giving you really good results, wouldn't you be using it all the time? Of course you would. But that's not the case, right? And the reason is we're not necessarily doing it the way it was designed. And thus, we're not seeing the unbelievable the effects it has, okay? And so then we come into this heat sensitive moxibustion system. And this is an interesting naming thing, because when we talk about this, it's like the first time I ever heard this, it's like heat sensitive moxibustion. What do you mean? Because moxibustion is heat, yes? Moxa is producing heat. So what do you mean heat sensitive moxibustion? But that is the biggest, that's the key to the therapy itself. It's the fact that your body, the human body, will respond to moxa in a very, very specific way when done properly in the right area. And it's not feeling just warm, okay? And the finding of this, so Dr. Chen is the founder and the pioneer of the heat-sensitive moxibustion system. And he is based in the Jiangxi University of TCM in China, all right, in the city of Nanchang. And so what they realized was that, wait a minute, number one, we're not getting the results of moxa. Number two, sometimes these strange phenomenon pop up when doing moxibustion. And in reality, the strange phenomenon that pop up during moxibustion tend to result in a better therapeutic outcome. And so they started to research this. And this is actually a culmination of over 30 years of research from Dr. Chen's group to finally solidify this system that we call heat-sensitive moxibustion. It's actually amazing. It's like I feel people like him come around once every couple decades. It's not every day, and so very, very intuitive. All right. This is just some of his credentials. We're not going to talk about them all. He's like a national icon in China for moxibustion. His group basically won the equivalent of a Nobel Prize for TCM in China, which is actually quite amazing. He didn't win the Nobel Prize, but the equivalent of what a Nobel Prize, the honor that would bring for advancements in Chinese medicine. And they're actually trying to think about, are they going to put heat sensitive into the textbooks? Are they going to sort of rewrite moxibustion? Because it is that profound. Okay, it is that profound. And so we actually had the first time he came to Canada, which was a couple years ago. This was sort of the first group in Calgary, and it was an amazing seminar where he came and taught us all, taught everybody level 1, all right. And so it was a great turnout with people from, I think it's from Edmonton, BC, all over the place, just to hear him talk. Because even if you live in China, and even if you worked in the same hospital as Dr. Chen, that doesn't mean you get to talk to Dr. Chen, and it doesn't mean you get to listen to him talk, right? It's actually, he's a very, very tough person to actually talk to and actually learn from. And so it's a privilege because he is sort of a partner with us, and so we can bring Dr. Chen over, which is great, okay? And so when we're talking about heat-sensitive moxibustion, there's something that we're going to talk about, and it's this concept of qi sensation. All right, and so this is what puts it different. We are not just putting moxibustion on someone's knee or randomly putting moxibustion on someone's stomach. We just do it for 10-15 minutes and we call it a day. No, there are discrete parameters for this system. And so Dr. Chen has over 100 published articles, and this is one of them which I find very interesting. And so it's talking about the comparative effectiveness of Deqi sensation and non-Deqi sensation of moxibustion. And they were treating knee osteoarthritis, all right, knee osteoarthritis. And what they showed, right, was that they were doing acupuncture, and these studies are extremely well controlled, especially coming out of his lab and his research group. And so they're doing moxa sort of in a triangle, bilateral knee eyes, which is Xian, and then the crown head, which is Heding, all right? And so lower extremity 2. And they're comparing sort of the statistics as far as recovery and symptom management. And what they found was that the qi sensation gave a more superior therapeutic outcome than the non-qi sensation for knee osteoarthritis. All right, and they've done many different studies on knee osteoarthritis, and the most amazing was when they had a study group of, I believe, 102 people who were on the waiting list for knee replacement surgery. There are roughly 2,000 people in Alberta on that type of waiting list, right, waiting for a knee replacement. And after they did a series of heat-sensitive moxibustion treatments on these people, out of the 102, I believe 86 of them no longer required knee replacement surgery. Those are profound results, just profound. So what do we mean you don't need the knee replacement surgery? That means that you can walk upstairs and you can do your daily activities with no problem, right? The one thing that we don't want to focus too much on is, bone spurs, structural deformity, right, within a knee. So Dr. Chen actually brought this up. It's very interesting. So if someone comes to you and they have bone spurs and they have structural issues within their knee, and you treat them over a series, say 2 months, and now they have no pain in their knee and they can go upstairs and their quality of life is improved. Is it necessary for them to go and scan their knee again to see if that bone spur is there anymore? Actually, it's irrelevant. All right, it's completely irrelevant, because some people can have structure deformed and have no symptoms. Some people can have major symptoms but have nothing structurally wrong that can be detected, and so that doesn't really matter. Okay, so the fact that they are deemed to require a knee replacement, why? Because their cartilage is worn out, because they can't walk, because they're always in pain, they cannot put pressure. If all of those symptoms are gone and they stay gone, we're not talking about only feeling better after you get the treatment. These symptoms are now alleviated. Their quality of life is good. They are able to walk around. They're able to enjoy their life again. They do not need the knee replacement surgery. Job is done. Right? It's amazing. Okay. That's not to say, nothing is perfect. There's no one system out there that is superior than everything else. You want to have the most tools in your toolbox as a practitioner, right? And Moxa here basically trying to show you that it is a very, very potent tool. Okay. This is a really cool study as well. Actually looking at heat-sensitive moxa in 2014. What it's trying to show you is the qi sensation, once again, the moxibustion qi sensation, which we'll talk about. It triggers a physiological response in the brain. All right, so phase coherence changes at the beta theta frequency range. They've also found changes in the alpha 2 range. Okay, and so this isn't trying to necessarily map out exactly what is happening in your brain. What this is trying to show you is when you do heat sensitive moxa, you get a different brainwave profile than when you don't do heat sensitive moxa, right? And so this is trying to show you that it has a very significant effect on the central nervous system. It's not that just people feel better. That's one thing. People get a treatment, they feel better. Pain's gone, digestion feels better, etc., etc. Those are all subjectively collected information, right? However, this is physiological data that's potentially supporting that same physical data, right? And this is super interesting. We can't do any of this in Canada because we don't have any funding. But it's amazing that Dr. Chen and the group, they have all the technology at their disposal. They can basically research and study anything they want, which is great, okay? So yeah, this is sort of the article that went around with it. So heat sensitization, I just highlighted areas I feel a little bit more interesting. Response are being reported during suspended moxibustion, that's using the stick, okay? And so people that had back pain, they were treating using an area around Do3 on the back. And what they found was significant decrease of current densities in beta frequency band in prefrontal, primary, and second somatosensory and cingulate cortices, as well as increased current densities in the alpha-2 band in the left insula. No changes were detected in patients without sensitization responses or in post-moxibustion phase of either group. These data indicate widespread activity changes across different frequency bands during heat sensitization. So basically, it is a nervous system response to the moxa heat given in an area of the body, right? And this specifically was on the back, in the low back lumbar region, okay? Super, super interesting, all right? And so, giving you a little bit of data there, Dr. Chen has over 100 articles. And so what are we looking at here? What is heat-sensitive moxibustion? It's a new concept. I guess not so new. It's been developed over 30 years now. But in 2015 is when it kind of got introduced to the rest of the world. So it's only been really out there for everybody to see in the last, let's say, 5 years, 6 years, right? So the new concept here of qi sensation. We understand qi when we talk about acupuncture. The qi. You needle a point, you should feel the qi at the point, right? The practitioner, the patient feels the qi. However, in moxibustion previously, nobody understood that actually when you do moxa, you need to feel qi, right? And actually, if you've done moxibustion a lot in the past, it's very likely that you probably came across qi sensation and nobody really knew about it and was talking about it. You didn't know what it was. And you just kind of like, oh, interesting. I'll just ignore that. Okay. Super, super interesting here. All right. And so if you look at this diagram, this is normal moxibustion. I'm just going to hold it over. It's going to get hot. All right. It might get red. It's going to get hot. However, looking at the heat sensitive system, what are we seeing here? Oh, wait, we've got a traveling of sensation. We've got a descending of situation, a spreading of sensation, right? We're actually getting different phenomenon from different areas of the body using moxibustion. And this is what we call moxibustion qi sensation, all right? And so what do we mean here? The fact is, moxa points are dynamic disease-related sites that have a specific induction due to external stimuli. So basically, what it's saying is, when your body has illness and you have pathology or imbalances, certain areas of your body will be more sensitive to moxibustion heat. Okay, and so it's almost like everybody will have a moxa point profile, right? Depending on your constitution. And that may change, right? Tomorrow, maybe you won't be sensitive in these areas because you're feeling better. Okay, it's dynamic, it's constantly changing. All right, and so moxa points have different states: responsive, resting, and sensitized. Not just differences in location. What that's saying is, let's say the famous acupuncture point Li4, Hegu, right? Everybody knows that. It's just located here. What it's saying is, on certain days, Hegu, I can moxa it, and I don't get qi here. I'm not feeling any sensation. I'm just feeling hot on the skin. That means Hegu itself right now is not responsive, right? Meaning it doesn't need to be moxed, okay? But all of a sudden, let's say I've got some digestive issues, or I'm stressed out, or I've got a headache, and I've got stagnation. All of a sudden, I moxa Hegu, and now it's different. Now I'm feeling a radiating heat that's spreading to my entire palm. Well, that's because Hegu now is in a sensitized state because of the pathology within my body. Okay, so the moxa points themselves, I guess the question is, well, what's a moxa point, right? And a moxa point is a point that is sensitive to moxibustion. It's not a standardized acupuncture point, all right? We can use the standardized acupuncture points as a rough direction of where to moxa. However, we're not actually necessarily looking for acupuncture points, okay? And so I can't draw you a chart of moxa points like I can for acupuncture. Li 1, 2, 3, 4, 5, right? I can't do that for moxa, okay? It's the reason why is because they're constantly changing, they're dynamic, and they're based on the disease state of the person, okay? So in the course of disease, the surface of the human body will exhibit moxa points that are particularly sensitive to heat. These will respond to small stimulations with large reaction, meaning all I need to do is bring that moxa stick over and look and detect for sensitivity. And once I find it, then I know, ooh, that area of the body needs moxa, all right? And so this discovery is profound, because if you think about it, what's it saying? As a practitioner, when we're doing acupuncture and herbs, I do an inquiry, I talk to you, I collect information, I look at your tongue, I read your pulse, I look at your face complexion, and I get a diagnosis, right? And then I got to decide on what points to use. And that's an art. Okay, I love doing it. With moxa, with heat sensitive moxa though, I hear what you have to say, I take your tongue and pulse, and I say, okay, I have an area where I feel I'm going to start, right? And then I start that area by detecting that area with my lit moxa stick, okay? Let's say someone has asthma, and I'm looking around this area of the chest, and there's an area near, let's say, lung 1, lung 2, right? And that area, it feels really hot, and that heat is penetrating into my lungs, it feels like, and filling my entire thoracic cavity. That is a moxa chi sensation, right? However, what just happened here? The patient's body told me exactly where to moxa, right? I didn't have to really think about what points to use, and then hopefully I'm needling it right, etc., etc. In reality, the body tells you what points need to be done, okay? And that is actually quite a profound phenomenon. That's amazing. The fact that you're listening, because when you're a practitioner, what are you doing? You're trying to find that balance between the practitioner and the patient. How are you syncing together? How are you gelling together? How are you coordinating with this person? Well, this person is going to tell you exactly where to moxa, right? Depending on their response and their sensitivity. And so in reality, you can't go wrong, right? The fact that a point is sensitive means the body needs moxa heat at this point, right? So I'm not saying you don't need to do diagnosis and that's not important, but this kind of makes your job a little bit easier because all of a sudden the patient's body is telling me where to moxa. I don't have to think, well, what point was good for dampness again? Blah, 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 blah. The body's telling you, okay? And so it's almost like in autopilot, all right? And that's a really, really interesting phenomenon and very, very interesting discovery. Whoops, excuse me. And so we're looking at moxa in general, we're looking at these key concepts of the moxa points. How do we actually find these points? Well, it's interesting because with the points, they're never set and they're never fixed. However, it's a two-step process. And I feel understanding this also makes you a better acupuncturist. So there's something that we call a rough location and then a fine location. And the rough location is your textbook, right? Where it says, okay, Li4 is here, Si3 is here, etc., right? 合谷后溪, right? And it's like, okay, great. However, now I'm going to Moxa this area and look for sensitivity. It may not be right on here. It might be over here more. It might be over here. It might be just a little bit down from Si3, right? And so that's what we do with fine location. But in reality, that's how you should be doing acupuncture as well. And I think that is a mistake that lots of people maybe do make in modern day, where they remember the textbook and say, oh, it has to be, Li4 has to be halfway between these two bones on the high point, it has to be there. That's where it roughly is. You need to feel. You need to ask the patient, how does it feel in this area? Okay? And so in reality, this is how you're supposed to find points, whether it be acupuncture, whether it be moxibustion. All right? And this is all sort of, I didn't put it in this slideshow, but during the full seminars, I typically do. There's lots of quotes from the Neijing that's actually alluding to all of this. How do we find acupuncture points, right? You have to feel. You have to get qi and you have to feel. All right, that's a big part of what we do. Okay, and so I'm just listing here for you the different types of moxibustion qi sensations. All right, the different types of moxibustion qi sensations. And so penetrating, dispersing, transmitting, those are pretty easy to understand. I think I throw it on the next slide as well. This should be animated. Yeah. Okay, so I'll go there in a sec. And so with these different sensations in general, these are the standard moxibustion qi phenomenon that Dr. Chen and his group have identified over the years. All right, have identified over the years. And so one thing you should remember is qi sensation for moxa does not mean heat on the surface of the skin. It does not mean the skin turning bright red and feels like it's burning. That is not qi sensation. You should never even get to that point. If all the person is feeling is lots of heat, just really hot on the skin, that's not the right spot. Don't do it there anymore. Go somewhere else. Okay? So what we're looking for here are very, very specific phenomenon. And this picture here kind of shows you, don't try to look at them all at the same time. Oh, excuse me. Or else it doesn't make any sense. All right. And so if we look here, like at this picture, what is going on there? Well, the heat is, it's not going down his arm. What it's trying to show is that heat is penetrating deep into the tissue, right? So even though I have the moxa stick up here, right, you can feel the heat go inside. And this is actually very, very common on the abdomen and the back mostly. Where if you, let's say you did this on the stomach somewhere, let's say like Ren 12, I've had patients tell me that what it feels like is they can almost feel a silhouette of their entire stomach, and it's all warm inside. Even though the stick is only 2.5 centimeters, their whole epigastric region is warm, and it feels like they can feel the borders of their stomach, and that's what penetrating heat is. What's happening in this picture here? Well, the heat sensation is actually growing, right? So even though it's only 2.5 centimeters, sometimes the heat sensation grows so much it could cover your entire upper back, right? Okay, on the surface, just spreading. Okay. If we look at this picture here, this one's super interesting. This is one that I think a lot of people have maybe experienced in acupuncture, and this is what we call transmission. And so what do we mean by transmission? The stick doesn't move, but this warm sensation is moving, as you see in the animation. The warm sensation is moving to a distal site, which is actually pretty amazing, right? And usually this means that that site, that shoulder, is where the problem is. So they're using a dew point actually to treat the scapula in this scenario. Super cool. Okay. This one here, what's happening here? Well, I'm doing moxibustion on the forearm, but they're feeling heat above the elbow, right? Okay. Very interesting transmission or spread, a jump of sensation. A jump of sensation. And I've done this on lots of people where I'm moxaing, let's say somewhere on the back, or I'm actually moxaing on the leg, and they say, "Oh my goodness, my whole shoulder feels warm," right? And you get this a lot in acupuncture, right? You needle a point. I often treat shoulder pain with the ankle or the wrist, and I needle those points, and all of a sudden I tell them to move shoulder right away. The shoulder feels better, and like, oh, interesting. Okay, it's because of how you're sending chi into the system, right? And in TCM, there's a very important concept. You're supposed to allow chi to arrive at the site of disease. Okay, at the site of disease. And so this one here is another sensation where you don't feel very hot on the surface, but you feel all of a sudden heat growing deep inside. All right. And so once again, I could be moxaing right here. I don't feel that much on top, but all of a sudden I feel like it's almost in my back, right? It's gone through and then growing in a different part. And the last one actually is the most interesting. Those Chinese characters are flashing very quickly though. And so what's going on with this last one? It's something that we call, I'll go back here, non-heat sensation. And this is actually very, very profound. So you're telling me I'm using something that's lit, that's on fire, and when I put it on the body, I don't feel hot. Instead, I feel cold, or I feel tightness, or I feel tingling, all right? So these are things, or soreness, or achiness, or distension, kind of like typical acupuncture needle chi sensation. And so this is actually the most interesting of them all. And in reality, this is the one that if you get this sensation, you'll get very, very strong therapeutic effect. Okay. This type of sensation seems to be one that has the strongest effect on the human body. All right. And so those are the main concepts of chi sensation with moxibustion. All right. It's very, very new. Okay. And so it's thought that in the population, typically, even a healthy individual will probably have 10% of their points sensitive to moxibustion. The reason why is nobody's 100% healthy, right? It's impossible. It's impossible. However, in patients with serious disease or pressing concerns, they have way more moxibustion areas that are sensitive to heat, right? But then as they heal and as their condition improves, that should drop back down to a steady state condition, right? And so once again, it's trying to show that the heat sensitive spots are dynamic. They change depending on the health of the individual, all right? And so here's some body imaging of interest here, of interest. Let's look at this picture right here. And so heat sensitive point found at Ren 4, Guanyuan, which is on the lower abdomen, below your umbilicus, yeah? And what do we see from thermal imaging? This is actually a thermal image of the back, right? And so they found a spot that actually lit up. White obviously is the hottest, right? So even though we're doing moxa on the stomach, right, we're getting massive actual thermal temperature emittance on the back, right? So classic sort of jumping heat, sort of distal heat or penetrating through. Okay. Here, these are done on UB13, right, which would be right about here, yeah? But look at the heat sensation. It's covering the entire back, yeah, from this tiny little moxa stick right in that area. And then here's an example of GB21, and it's traveling up, up the head. The next slide shows it. So here we have a progression of GB21 Moxibustion and watching the heat build and build and build and build. I've personally seen this in many patients. I've also felt this myself. It's an amazing feeling. That's one of the nice things about Moxa is it feels good, right? Some people might not like needles or might not like cupping or gua sha, etc., etc. But Moxa always feels really nice. Yeah, people feel comfortable. Okay, and so here we have some physiological data. So we have people feeling better, the subjective recordings of the patient, people feeling better, my condition's feeling better. We have an activation of brain waves, and then we have thermal imaging. And so it's not just like we're doing Moxa and people say they feel better, we call it a day. The evidence is compounding as far as it is creating physiological changes within the body itself, not just subjective recordings from people who think they feel better, etc., etc. And so we're looking at the sensitization timeline because now, you know, I'm sure you're asking, well, how long do I have to do Moxa for then, right? Basically, it takes roughly 10 minutes on average to find your heat sensitive spot, right? And you'll continue to Moxa that spot until it'll reach a maximum, a peak, right? And then this is the interesting, this is the second part of the whole system. Your body actually desensitizes, meaning you use the Moxa stick to find an area that is responsive to Moxibustion. I got my chi sensation. Now what do I do? 10 minutes, 15 minutes, arbitrary? No. You keep Moxaing that spot until that sensation goes away. And so we're actually looking for a desensitization. So it's a two-step thing. One is sensitization, finding the heat-sensitive spot, and two, Moxaing until it disappears. And that's the end of your treatment, right? And it usually takes, you know, I guess half an hour, 45 minutes is pretty average, right? Pretty average. Okay. And so what did I just say then? This is profound as well. So not only is the body telling me where to Moxa and what needs help, it also tells me how long to do it, right? And so it's almost like a self-contained system, right? All I have to do is find the spot and leave the Moxa there and then remember to take it off, right? Not too hard, okay? Not too hard. So I'm gonna skip that actually. And so when we're looking at sort of the current state of Moxibustion in around the world, let's say, obviously 500 hospitals are using heat sensitive now, right? And they have these pilot projects, which I got to see when I went to Jiangxi last year. And it's something called Moxa Village, which was actually quite amazing. So these pilot projects are small farming villages, you know, maybe only 15,000 people or something, right? They educate everybody on Moxibustion. And so they have a center within their community where everybody goes and learns about heat sensitive Moxa and actually gets heat sensitive Moxa done. And it's actually shown to be a huge draw because it takes away the need for other types of medical intervention and thus saving the healthcare system a lot of money. But then it increases awareness and lets people actually treat themselves. It's actually quite an amazing system as far as the whole Moxa Village goes. We got to see it firsthand when we went there last April, right? And it was just amazing, just amazing. Okay. And so with its expansion sort of into the world, Moxa now is, people are starting to understand now, oh, wait a minute, heat sensitive Moxibustion, this is actually something that's significant. This is actually following the ancient sayings of traditional Chinese medicine better than what most books are saying these days, right? And so it's spreading all over the world. and we have the luxury of having it here too. Okay. So as far as the future of heat-sensitive moxibustion in North America, Calgary, where our school is, we've set up a headquarters for heat-sensitive moxibustion. And basically, through the hospital affiliation and through SNAP TCM, we will be hosting seminars about Moxa. Okay. And so probably some of you are going to ask me, well, these things really smoke up bad and they also smell. I agree 100%. And if you've gone to China, you studied in China, or you've gone to hospitals in China where they're using this type of moxa, there's smoke everywhere. The room is filled with smoke. Even though Moxa Smoke has been to not produce any ill effects on the human body within normal physiological working conditions. So, you know, sitting in the hospital doing Moxa during the day isn't hazardous to your health. However, in North America, we cannot do this, all right? And so that is a major, major issue as far as moxibustion goes. And so how do we do this heat-sensitive system? The system seems interesting. It might have sparked your interest. It is very, very good. So how do we do it? We have basically a smoke and odor eliminating machine, which I will show you just to see how it works, right? And it is amazing. It eliminates basically all the smoke, and I'd say 99% of all odor coming off these sticks, right? It's patented technology. It's actually quite amazing. You'll be surprised to see how well it works. Okay, and so that's kind of how we get around this. Because remember when I talked to you about that smokeless stick, it's not producing the right amount of heat, right? And these things produce the right amount of heat. However, these things also produce a ton of smoke and a lot of strong smell. Okay, and so we're talking about this type of moxibustion in general. We have 3 levels of training basically for this. And, you know, this was an introduction just to tell you what it's like. However, it's usually, and there's 3 different levels. We actually are doing a Zoom version of our level 1 Moxa training coming up here at the end of this month. And so for anybody that's interested, we have an upcoming seminar. You can look at the QR code here. This is a link to the Eventbrite, which you can register at. All right. It will be basically split up into 3 days, 4 hours each, and then we'll have an optional hands-on clinic session. So normally how the seminars run is we do 2.5 days of lecture and practice, and then we do a full half-day afternoon of actually seeing patients for volunteering, like volunteer patients. But we can't do that due to COVID restrictions at this time. And I think a lot of you wouldn't want to be sitting in a room for 3 days with people you don't know. And so we are doing sort of an online certification version of it. Okay, so if you're interested in that. All right.